today and now. This is a YouTube live now, so I'll have to be a bit more formal, but it is well. But yeah, we were discussing about contraception. So I hope my class is still with me. We were doing this on our Wheels for Life channel. But if not, well and good, we will catch up. At least here we are able to record our video. So all of us will be able to see it. So I'm just going to add this to stage. Yes, let's talk about contraception and what it does for you or to you. So what is contraception? I'm starting again from the loop. Contraception is how we help our body understand, rather how we plan for the babies that we want. It's a concept surrounding family planning, and it's a new concept, but not so new. Started around 1980, 1990. But before then, our mothers knew how to plan for contraception, and they actually did well. They got their babies when they wanted to get their babies. There are natural methods of contraception. There are plants that can be used for contraception. That will not be my topic of discussion today. If you want that discussion, we can take it offline, or I can do it on another day when I've already really researched into it. But today we're going to be looking basically at the methods that are well known or well versed, that are medically backed, and then we will progress from there. So before you do any contraceptive method, you need to understand your body. I had started discussing about natural method of family planning. We have three major types of family planning. We have barrier methods or mechanical methods. Those include condoms, those include coils, those include barrier methods, the female and male condoms, the diaphragms. If you've heard about the diaphragm, we have the rings. Those are all mechanical methods. And what they do is they try and prevent the sperm from reaching the egg in the easiest of terms possible. They try and prevent the sperm from reaching the egg. That's how they work. Then we have the hormonal methods. The hormonal methods include E plus P, which is estrogen and progesterone methods. And then we have the only progesterone methods. And then we have the last method of contraception, which is the natural methods. Okay. So natural methods have been known to fail quite a bit. I was talking about how they work only 85% of the time, which means they have a 15% failure rate. That means if there are 10 of us using natural method, 8 are probably not going to get pregnant. 2 of us or 1.5 of us is going to get pregnant. And this is when we use it perfectly. What does perfect use mean? When you use it in the way we have described it to you, as the way to count it, or as the way to know your method, or rather know your body. So perfect use, but then still 2 people will get pregnant. We have that same rate for a normal rate of people who are trying to get pregnant. So if you're trying to conceive and we are 10 of us, only 2 of us may conceive in a month. So it's similar, sort of. But I'll discuss about fertility another day. So today we're discussing about preventing pregnancy when we are not ready. So I'll also discuss about emergency contraceptive. If you're not able to finish today within the 30 minutes I've targeted, no worries. We can do this as a part 2. And God will be with us. So we need to understand our options and for your peace of mind. So what is family planning? Again, it's about your freedom. It's about your health choices and giving you the confidence that you require. And it reduces the risk of unintended pregnancies. So I had started talking about natural methods. I think this we have already mentioned. Yeah, actually, it's an important slide. Before we choose the method for you, we need to understand How long do you want before you want another baby? Is it 3 months? Is it 6 months? Have you had a miscarriage and you've been told wait 3 to 6 months before you get another baby? Or are you trying to space them for 2 years, for example, to breastfeed? Or do you have a cesarean and you've been told you need to space and give some time before baby? Because that will guide on what type of family planning to use. How is your memory? Do you have a foggy mind right now, and telling you to remember taking pills every day would be difficult? Or are you very organized, you do everything by the dot, and that may not be a problem for you? So that's also something important for you to back of your mind remember. Do you prefer a long-term option? Are you having any medical condition, hypertension, diabetes? Are you breastfeeding? Because then there's some methods we can't give you. In this case, estrogen and progesterone is not a method we're going to be able to give you. And then what side effects are you comfortable with? Because for every medication that we give you, it has a side effect, even and including if you don't know how to count your days, and this is very important, if you don't know how to count your days, then you may not be able to use this natural method. Okay? And that, and how, what do I mean by counting your days? If your period starts today, that's day one. We need to know that if your period starts today, that is day one. And that day one then means that you start counting your cycle from then. So you bleed for 4 5 days, and then you have your ovulation and what have you, and then after that you get another bleed. How you count your cycle is from the first day you bled to the first day you bled again. For most people that is 28 days, for some that is 26 days, for some that's 35 days. Okay, but based on where you are in this pathway, then if you, for example, bleed after 28 days, you subtract 14 days, then that means you ovulate on the 14th day. Okay? So anything before 14 days becomes your first half. So from the day you bleed to the day you ovulate, we call that the first half. That's your follicular phase. And it will make sense in a minute, but that's your follicular phase. So this follicular phase is what will guide the pills that we use, but more so your safe days. So if you have this, if you count for your days, then from that 14th day, if you have a 28-day cycle, from that 14th day, you know that the sperm is able to live for 5 days, which means you go for 14 minus 5, from day 9, you are fertile. And then the egg lives for 2 days, 48 hours, maximum 72 hours. So from day 14, which is where you ovulate, you count another 3 days. It's usually 2 days, but I usually give one for safety. So 3 days. So from day 9 and giving one more day for safety. So from day 8 to day 17, that window, 8 to 16, but 8 to 17, that window, please, 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 you're fertile. You can and will conceive if you have any sexual intercourse on that time period. That's very important if you're using natural methods, but it's not sure bet. The other thing you need to look at is, do you have a rise in basal temperature? So if this is a method you want to attempt, and remember it has a 15% failure rate, but do you do you have a temperature thermometer at home? When you're fertile, your temperature goes up by one degree. I hope that is clear. So if you are fertile in this window, then if your normal basal temperature is about, let's say, your normal basal temperature is at 6.2 or 36.4, it will go up to 36.7. It's not a very high mark. When you go to the hospital, you're not going to be sick, but it has risen by about 0.5. So that also tells you, okay, here we are fertile. The minute you ovulate, it's going to remain high for 2 days, then it will drop. Okay, so that's also something that you need to know. Sorry, it's going to be normal. When you ovulate, it's going to go up by 0.5. Sorry, I really confused you there about basal temperature. I'm going to put a caption here on how to look at basal temperature. The other thing you need to look at is your mucus. The cervix usually has a discharge, and you need to look at that discharge. How is that discharge? So when you're about to ovulate, it becomes clear and stretchy. So it becomes clear and stretchy. You can pull it this way. Like when you put it here, you can pull it this way. Okay, it's not a tutashika hivi, then you have a kabit here and a kabit here. That's usually post ovulation, but you'll do this and it will actually stretch. Okay, when you see that, you are ovulating. Okay, so please, that's a time to check. And something simple that my mom tells me is, if you feel a time that you really want your partner and your partner is looking at you like, you're something so hot, you really are every time of month, but there's a season where they start looking at you like predatory, it means you're fertile or you're in heat. If you look at animals, you're in heat. So in the same concept, you also disappear. Okay, so in that window, give yourself shugli, go to the living room, do some things, or use protection. And when you use protection, you have to use it in the right way. We'll get back to that. Okay, so that's natural, that's fertility awareness. And remember, it has a very high failure rate. For it to work, you also have to have your partner on board. And I'm really stressing this because we don't discuss natural methods enough. Your husband has to be involved, or your partner has to be involved. If they also don't want babies, this is the season that you work together to avoid one another, lack of a better word. And it can only work if you have a regular cycle. If you don't have a regular cycle, then it won't work. Because if you don't know, I have a 35-day cycle, and that's a normal cycle. That 5-day cycle, you subtract 14, you'll be around 21 days. Then you subtract the 5 and 3 that I was talking about, then you'll miss the mark. So the easier way is to have an app. The app usually now calculates it for you. It will tell you when you're fertile. You have to feed it every month successfully and use it for 3 months to track before you can now start using it to predict. We have different trackers. I've not been paid by anyone, but I typically use the period tracker. It's actually called period tracker. It has a pink flower there. Okay, and whether you're using any method or not, please use the period tracker. Good for you. Yeah, so it tells you when you come to the clinic. Also, when you tell us about things, we're able to know how you're faring. Okay, so that's the period tracker. Another thing that we use is the LAM method, which is a natural method. So LAM is the lactational amenorrhea. As I said earlier, it's only used by those who are breastfeeding. For the first 3 to 6 months, you have to be breastfeeding on demand. If you're not breastfeeding on demand, it is not the method for you. Leave it alone. And that includes those who are pumping. If you're pumping, that's not exactly lactational amenorrhea, because you may not able to pump on demand the 3-4 hourly that we are talking about. It also doesn't trigger a lot of prolactin hormones as much as your baby actively latching would. So if you're using that, then it may not help you quite a bit. Another thing that you need to know is that after you give birth, After 21 days of giving birth, your ovulation comes back. After 21 days of giving birth, your ovulation typically comes back. So if you forget, or that you're not breastfeeding on demand, as we are saying, then you're likely to get pregnant. If you're waiting for your periods to come back so that you go and get whatever type of family planning, and I'm talking because I know I also speak to very many moms who've just delivered. If you're waiting for your periods to go get for contraception or family planning, then you may be a bit late, because 3 weeks after you give birth, you actually start ovulating. Okay, which means that women who deliver and get pregnant immediately. Okay. But as I've said, breastfeeding on demand helps you for 3 to 6 months, but it also has a high failure rate. Barrier methods, the female condoms, the male condoms. Female condoms are difficult to find. They typically look like a bag like this, then it's twisted and put inside the vagina. It has to be put 2 hours before you meet your said partner. Really uncomfortable method if you ask me, but if you're one of those ones who use it, and it works for you, well and good. The male condom, for us to say that it is being used perfectly, it has to be the right size for the male. It has to be put with the tip at the top, just the way it's usually rolled. Don't overturn it. If you overturn it, it's not helping you. It has to be rolled down the way it comes from the packet. It has to fit well. After your partner has ejaculated, this is not the one that you go and get for another round with the same condom, you'll get pregnant. You have to remove it, change the condom after wiping. Okay, and you have to remove it when your partner is still hard, for lack of a better word. So if you wait until the penis is flaccid, especially inside you, sperm is going to start leaking out from the sides, because remember, it's a bag fitted, so it will start leaking out on the sides. Again, it's not going to help you. So with perfect use, condoms actually confer for you a 91%, again, not the highest, has a 9% failure rate. But if not used well, it's a problem. Okay? So that is the barrier method. Barrier method, however, is the only method that protects you from STIs. Because we talk a lot about, cheating and all these things. If you're not so sure, or you're not, then this is the method for you. If you're not sure, if you're the only partner, if you're not, you get what I mean, then a condom, even if you're using other methods, this is the safest method for you. Why? It is the only method that confers protection against against sexually transmitted illnesses. All right. So now I'm going to go back to the combined hormonal pills. So combined oral contraceptives are hormonal methods. These hormonal methods are estrogen and progesterone based. They mimic the body pattern. So the body usually has estrogen, it peaks, and then you have LH peaking, then you ovulate, then the estrogen goes down, and then progesterone usually is a bit on the lower side, then it goes up, and then at the end of the cycle, both drop, and then you get a withdrawal bleed. So combined estrogen and progesterone works in the same way. Progesterone is at a certain level, estrogen is at a certain level, and therefore they prevent you from ovulating at all. But because they mimic the body's pattern, they have both estrogen and progesterone in the dosage that is required, although slightly minimal, so that you don't ovulate. We use them a lot for protecting you. We call it balancing hormones. I was given medication to balance hormones. This is it. So you'll be given a month or two, and then we remove it so that your body now resets itself according to the right FSH, LH that your body should have. It's also really used for hormone replacement therapy if you're menopausal. Okay? But even as I say that, it has its issues. Estrogen and progesterone will, when it's combined as a pill, the Femiplan, Microgrinon, Yasmin, all those ones, when combined as such, the level of estrogen that is there will reduce your milk supply. So if you're breastfeeding, then we cannot give you combined hormonal method. Then it predisposes you to clots. You can see some of the cons there that it predisposes you to clots. So if you're a smoker, be it shisha, be it weed, be it, but we were really looking at tobacco really. If you're a smoker, then this may not be the method for you because smoking triggers you to get clots. And therefore, if you're triggered to get clots by smoking, and then we add that you've gotten pregnant or not, and then add you have migraines, and then we add that you've had a clot before, then this is not the method for you because it will actually trigger you to get another clot. Okay, so we don't give it for the first 6 weeks if you're not breastfeeding. So assuming you're one of those ones who, I don't want to breastfeed my baby because of health reasons or because of choice, which is okay, then we can give you the combined hormonal method, but we can only give you after the 6 week mark because then we know that the risk of clots has reduced a bit. The okay, what I'm trying to say is when you're pregnant and when you're postpartum, you have a high risk of getting a clot, especially if you've had a cesarean section or whatever. But after you come out of postpartum at about the 6th to 8th week, then it is safe for us, and this is medically studied, for us to give you the combined hormonal method if you're not breastfeeding. If you are breastfeeding, we will not give you this particular method because it reduces your milk supply. Understood? So we will not give you if you're breastfeeding because it reduces your milk supply. If you have DVT, for example, then we will also not be giving you this particular drug. And why is that? Because it predisposes you to getting clots. IVF, okay? Or tuboplasty. Tuboplasty is another thing that can be done, although the success rate is not very high, about 50-50. Okay. Do contraceptives cause infertility? Not directly. Not for all of them. There are those, like I've said, for the progesterone methods, for example, the depot, that can take long. It can delay fertility in some people, not everyone, but in some people. So, if you're not fully done conceiving, that may be a method to avoid. Can the coil travel to the brain? No, it usually stays in the uterus. And if it gets lost, because sometimes they get lost, it's more often that it has been expelled outwards rather than it is lost. Okay. But there are some times where you can have a perforation. It goes into the abdomen. If that's the case, then it can be retrieved. But to get to the brain, really difficult. Do contraceptives cause cancer? Most of them are protective of cancer, especially breast endometrial cancer are protected by most of these hormonal contraceptives. However, if you have a high risk of breast cancer, we may avoid things like progesterone-based methods in you. Okay. Now, if you have diabetes, hypertension, epilepsy, asthma, before you choose a method, please go to your gynecologist. We will look at your health condition. If you had things like BP during your pregnancy, if you had things like diabetes during your pregnancy, if you had episodes of epilepsy, for example, and you had to be put on certain medication, these are things you need to really tell your doctor before choosing the right method for you. We've seen patients who have migraines and they're using the daily pill. That may not really help them because the daily pill predisposes you to migraine. So say something like that, you need to really talk to your doctor before choosing. So we call that a MEC. There's a MEC guideline, and it's actually online. You can go through it and see if a method is good for you or not. What are the best contraceptives after birth? Anything progesterone based? That's the implant, the injection, the mini pill, the Mirena, or the coil. Very good. Okay. LAM or breastfeeding is not very reliable, as I've mentioned, and you need to discuss at the around 6 week mark to know. So we are 7 minutes past time. I'll rush. Again, we said condoms are the only thing that protect you from sexually transmitted illness. Please, if you really are not so sure, combine condoms and another method for extra safety. So what's a take home for today? Choose what fits your life. If you're a busy mom, you're struggling, you don't know whether when it's Monday or Friday, the daily pill may not be for you because you may forget, unless you have something that will help you remember. If this is not suiting you, you're not tied there, please remove. We can put another one. I forgot to tell you that coils are really painful. If you have painful periods, they can increase your pain for some people. If you have heavy bleeding, they can make it heavier. But for some people, it's still fine. If you had a vaginal discharge and it was not treated, or it was inserted when you had a discharge, then it can predispose you. It will not give you, it will predispose you to recurrent infections. Why? The strings sometimes get the discharge trapped on them. And therefore, if you're not treating fast enough, then the strings can push the disease upwards, or you can be getting treated and then the strings reinfect you. Okay. So I'm going to take that for today. Family planning is love, it's not limitation. Please involve your partner, discuss it, work on it together, especially if you're using natural methods or barrier methods like the condom. Very, very important. And at the end of the day, we want a happy mommy. We want to make sure that you are comfortable. So I hope today's session was helpful. We will go in depth into the topics. I did not touch on on the danger methods of most of these pills, or what am I saying? I did not touch on the things that can bug you with each of the methods. So we can go one by one in this series and go over them so that we know what helps you and what's not. And yeah, I hope I have blessed you today in the smallest of ways. Thank you for your time, for those who started with me and those who are still here. Be blessed and see ya. Mwah. Bye.